industry trends. I'm your host, Vanessa Emerson, founder of Dental Speakers Bureau, and I'm excited to bring you this special episode today with several of our industry's teledentistry experts. Help me welcome to our call Patti DiGangi, Ivie, and Amber Lovatos. Welcome, you guys.
Hi. Thanks for having us.
Thank you so much for being here. You know, it feels like there's probably never been a better time to talk about teledentistry. Here we are, the first part of April 2020, and mid-pandemic. Hopefully, at least mid, maybe hopefully looking at the end. But we're in the middle of it, and of course, teledentistry is something people are starting to give a lot more attention to. Before we dive further into the topic, could we just start? Let's start with Eden. Go to Amber and then Patti. And could you just give us like a one quick minute? Let us know about you. What's your background in dentistry? What brings you to teledentistry, and how are you working in that area now?
Okay. My name is Ivie, and I am the Director of Customer Success for Mouthwatch, which has developed a teledentistry platform. I have been practicing dental hygiene for 15 years, and I use teledentistry in, 3 weeks ago, I used teledentistry in Head Start classrooms. I would provide all of the preventative care, and then we would connect through teledentistry with a dentist for diagnostics. With Mouthwatch, I help programs learn about teledentistry and then implement teledentistry technology into their program.
Awesome. Amber.
Yes, I am a dental hygienist. I am the clinical director at a nonprofit dental clinic. We use teledentistry for consultations, but I speak on teledentistry. I've spoken nationally on legislation. I like to kind of research practice acts and read the different things in rules and things that are ever changing. I'm a governmental affairs consultant for Mouthwatch.
Awesome. Thank you so much, both of you, for being here. And Patti.
My name is Patti DiGangi, and I also am a dental hygienist, but I've been a professional speaker for plus 25 years. And over the past 25 years, I've internalized 3 important beliefs. I believe we can have a world with no oral cancer, that we can cure, not just manage periodontal disease, and that we can have a world where we meet the goal of the World Federation of Dentistry to have a caries-free world by 2020. Oh, we aren't even seeing patients right now. But in order to do that, we have to have good metrics, and we need to understand that the codes of dentistry are the metrics for us. My brand was dental codology, the study of dental codes, and that's how I ended up getting involved in teledentistry when I wrote a book on the 2 teledentistry codes that were added to CDT a couple of years ago. I've also been speaking on it for a while, and actually what I did just at the beginning of this year is I rebranded to Beyond Oral Health, because everything we do is so much beyond oral health. It touches every other part of the body and is so very important. So that's a little encapsulation of what I do.
That's awesome, and love your passion. Thank you so much. So let's get started with the question that comes first and foremost to my mind is, what is teledentistry? What is it? What isn't it? And Eden, could you shed some light on that for us?
Sure. So teledentistry is basically using telecommunications technology to connect patients to care. And this is done in a variety of different ways. Teledentistry has changed drastically over the last couple of weeks in how we use teledentistry and talk about teledentistry. So let me talk about before COVID. Teledentistry was used in consultations, remote consultations between providers. It was used in the referral process to streamline the sharing of patient data. It was used extensively for mobile hygiene and allowing hygienists to take care to patients where they are and then connect through teledentistry with a dentist for examinations and diagnosis and treatment recommendations. Now that's changed completely, and all of teledentistry right now is happening, I should say the majority of teledentistry is happening patient to provider. So it looks very similar to like a teledoc encounter, where a dentist will have a virtual consultation with a patient to evaluate an emergency. And right now, it's one of the only options for dental care that's available.
So that's what it is then, right? Like, so in the past, us being able to connect people that wouldn't be able to get to the office. Now, me being able to talk to my doctor about the problem I'm having and then determine, is this emergent to bring in? You know, is there something on the what is it not side that people might tend to think that it is, or I could be reaching for something that isn't there, but is there a misconception around it that you're aware of? And anyone can throw in a comment here, Amber.
I do. I think that people think that teledentistry is just exams, and it's not just exams. It's sharing of any patient information for consultations, referrals, opinions, triage. It's not just exams.
Ah,
and I would agree with that. That's why I wrote an entire chapter on the various codes that we can use or might want to consider when we're in various teledentistry settings. Because if all we're going to go out and do is a bunch more prophies and fluorides or whatever, we're not going to really hit those preventive goals that I mentioned before. But people think it's just for public health and it's just for rural. It can be used very successfully in those places, but they're not. It certainly isn't limited to those. One of the things that I know I talked a lot about before, again, pre-full COVID, was